Hello, my name is Eric Bricker and I'm the Chief Medical Officer of Compass Professional Health Services. I'm a general internist, primary care physician. I did my training at Johns Hopkins Hospital in Baltimore, Maryland. Compass is a healthcare consumer advocacy firm that provides tools and support to healthcare consumers. One of the main tools and support that we provide is price transparency. And so what is price transparency? Price transparency is actually providing the in-network contract rate or the price of a medical test or procedure to a patient or a member so they would know in advance what something is going to cost them. And that's kind of a new idea or a new thought in terms of actually knowing what something costs in advance. And that's important because the price of healthcare services is actually very different depending on where you go, even in network. So I'm going to repeat that because that's probably the most important thing to remember in this message, is that the price of healthcare services is actually very different depending on where you go, even in network. And so let me give you a couple examples of that. So in one particular town or city, an in-network MRI could cost upwards of $2,500, and that same MRI in-network could also just cost $500 at another location. Or another example would be like an endoscopy or a colonoscopy, looking in the stomach and esophagus by a gastroenterologist. One facility might cost $2,200, and that same in-network facility could cost only $800. And so those prices vary significantly for a number of reasons. But just to kind of take you to the negotiating table between the insurance network and the hospital, this is kind of the back and forth that they go through when they are determining those prices. So what will happen is that hospital A will say, well, look, I want really high reimbursement for my MRIs. I want $2,500 in MRI. And so the insurance network says, well, that's really high, so you need to give us something somewhere else in the contract. And so the hospital will come back and say, okay, well, we'll more steeply discount, whether it be labor and delivery or outpatient surgery or something of that sort. So they might, let's say do a knee surgery for only $1,500, which is a pretty low amount. And so the network says, okay, well, that's great. And so they go back and forth, sort of horse trading, if you will, until they've come up with their final contract. Now, the network then goes across the street to Hospital B, and they have the exact opposite discussion. So at Hospital B, they say, well, look, we'll take low reimbursement for our MRIs. We'll do an MRI for $800, and the network says, oh, that's great. But then the hospital comes back and says, well, we want really high reimbursement for our outpatient surgery. We want $8,000 or $10,000 for every outpatient knee surgery that we do. And so the network says, oh, that's really high, but we'll agree to that. And so again, they mix and match until they come up with their final contract. And so they sort of go through that same process for all the different service lines, whether it be imaging or outpatient surgery or labor and delivery or even inpatient surgeries or what are referred to as med-surg day rates, just staying overnight in the hospital for something like a pneumonia. And at the end of the day, in aggregate, the discount at Hospital A is 50%. And then the aggregate discount at Hospital B is also 50%. So if you were to look at the discounts in aggregate, you would think that they were the same, that it's 50% at one place and 50% at the other. But really, it's filled with like 80% here and 20% over there at one facility, and then it's the flip opposite, 80% and 20% at the other facility. And so if you were to ask me, okay, well, which doctor or hospital is more expensive, the answer is really, well, it kind of depends. It depends upon the type of service that you're having and the way that the contract was negotiated for that particular service. So all that can be very complicated for a person as they're trying to use their high deductible health plan or their consumer directed health plan with an HSA card to navigate the healthcare system. But that is just an intro in terms of the sort of the roots or the beginnings of price transparency and why prices are so different in the same area within the same network. So to find out more, you'll see some information on the next slide in terms of how to contact me for your own free ebook and also more about our Compass blog. Thank you so much.